Dr. Esezobor, I'm so honored to have a chance to chat with you because what you do is represent the best of what Children's Burn Foundation has to offer. You're what we're all about. And I'm so happy to share with our supporters your history. So you practice in Nigeria. What's the name of the town you're in there with your facility?
First of all, I want to thank you for having me. Yes, I practice in Nigeria, and the name of my facility is Ura Specialist Teaching Hospital. I also practice in Radiant Scope Medical Center and some other places.
Where is that in relation to Lagos? That's the only place any of us know.
It's in the same south with Lagos.
Mm-hmm.
It's
Lagos.
in Edo State, and that is the south part of Nigeria. Mm-hmm. And that is the same place called the oil-rich Nigeria.
Your specialty is doing these burn surgeries, correct?
I'm a plastic surgeon, general plastic surgeon. I subspecialize in burns and some cosmetic surgery.
Mm-hmm.
Yeah.
How did you start your relationship with Children's Burn Foundation?
I think it started in 2016 at the International Society for Burns Injury when I was approached, I think in a small meeting, that they want me to do their burn surgery, that is for children. And I think it was in the evening of that same day, we had a dinner together and they gave me all the scope of what they want me to do. And voila, that's how we started.
Yeah. And at your facility, you do 6 to 8 surgeries a year for the children's burn that we participate in. And we support the cost of the surgery for the children down there.
Yeah.
It's much more cost effective for us to do the surgeries where you are for a couple of reasons. First of all, there are cultural reasons why it'd be difficult to bring them to the United States because they'd have to bring their whole family, language issues. And also, I was very interested to learn the follow-up part of the surgeries is difficult because you often have to go out into the villages to do follow-up, and many of them don't have the transportation to get into you and otherwise, right? So it's more cost-effective for you to do the work right there in your country as opposed to bringing them to the United States.
Yes, I think the children are more comfortable in their environment, and the language is easy to communicate with them. They understand what we do. The parents understand, and then we speak to them in the language they understand. Right. Now, bringing them across is difficult, because of that cultural shock they get within some week to some months of them coming into the United States. I feel it's more rewarding doing this in Africa, and also I would say
the recovery is probably better.
No, the recovery is better because we are able to go into the interland to see them, to follow up with them, and if there is any problem, immediately we can bring them in and do the work again and make it better than what we found. That means where we stopped in the first surgery. So I think it's so easy. It's make the whole thing a whole lot.
It makes the parents more comfortable too in their relationship with you.
Yeah.
And I was very interested to learn, and I saw some of your pictures, that the burn issues in Nigeria tend to be worse than the ones we're never used to them, but that we're exposed to in the United States because of their lifestyle there. For instance, scald burns are the worst ones there. And most of the time they have these huge cooking vats and these children get exposed to scald burns. Describe the circumstances.
Yes, I would say in Nigeria, you find there's this energy crisis. And so people use their some unconventional means for cooking, not like
open fire
cooking. Like you find the stove, you still find a lantern. That means the source of that is the fuel, and you find the fire just sitting on the fuel, and that is a problem that we find in Nigeria. And remember, Nigeria is a place where oil is being drilled. And there are a lot of things wrong with the pipelines. So people get products. In fact, people refine the oil, getting crude oil directly from the pipes, and refine it and make adulterated product. So some of this kerosene that people buy are actually they are not refined kerosene.
It's off-market
They are
kerosene.
off-market kerosene.
I get you.
And by the time they strike the matches, the whole house is in flame.
Oh my.
Then you have some cultural issues, situation where some people believe if a child has convulsion, all you just need to do is to put their hand and the feet in fire. So there are still some cultural belief that still practices that.
Oh my.
Then a situation where maybe some children have fever, they feel they should put the child near the fire. Sometimes they will develop febrile convulsion and fall within the fire. I have one I'm treating presently, and that is Emanuela. And she fell into the fire while, the mother kept her close to it during the spike of her fever. And she fell face on fire.
Wow.
So those are the things. Then most of the time, the cooking is done on the ground where the child could easily crawl into, even with your clothes, getting burns and the fire affecting them. So there's so many ways to get.
So you have, over and above your surgical responsibilities, you have educational responsibilities, which is teaching these people and these villagers how to protect themselves from these awful burns. Because I will tell you, before we talked, you showed me some of the examples of your astonishing, miraculous work. And these kids have really horrible circumstances that you sort of bring them back from, which is unbelievable. What got you into this specialty? Was this something you've been driven to since you were younger?
Well, I've told many people that maybe I misadventured into burns, because being a plastic surgeon, I started wanting to be a cosmetic surgeon. I want to make all the money in this world. I want to, be in the spotlight and all. But I just discovered in my journey through life, everything about burns just keep facing me. And not just burns, but children burns. That is pediatric burns. I found myself getting a fellowship to the UK to specialize in pediatric burns.
Where did you go to university?
I went to the University of Benin. That's after my postgraduate, after I became a plastic surgeon.
Mm-hmm.
I was adopted by the British Association of Plastic Reconstructive and Aesthetic Surgeon to come to the UK and be trained in pediatric burn in Birmingham Children's Hospital. So I was there for some time in 2010, and I learned some basics and some other complex things about burns, but I didn't see the kind of burns we see in Nigeria. So as I came back to Nigeria and started practicing this, that is based on somebody just need to help these children. I found Children Burns Foundation, who were ready to give all the support. In fact, they gave support from the time of burns to even rehabilitation, and it makes it so easy for me. So you will see it's just a kind of something I didn't expect, but I feel there's a supernatural power, and that's God pushed me through burns, even though I was trying to go into something different. But now I think if you ask me again and again, I would want to work for these children. They don't have to tell you thank you, but that smile.
Is it true that children's skin can recover from those procedures better than an adult's could, right? So or am I wrong about that? It just seems like if they have a longer lifespan to recover from, they're more likely to have a better outcome.
Yes, some children's skin are actually they recover faster. I would say the younger the child, the better. But as they grow, sometimes you find that they have this recalcitrant keloid or hypertrophy scar. And those are really difficult when it comes to reconstruction. Now, in those cases, the more you reconstruct, the more the keloid grows, the scarring becomes worse. So sometimes you must be able to know when to come in when it comes to reconstruction. You must be able to know when to come in. You must be able to know when the scar is not as angry as it was when you met them. I use that word, sorry.
I know, I love the way you describe it.
Yes, it's not as angry, but you must study the scar. You must understand the scar for you to be able to achieve that goal you want to. If it is still angry, you need to talk to the parents and tell them, let's use other means until we are able to do surgery for this child. But with all, I think we are getting better. We're getting better at it with more children coming to us, and we're more adventurous now to be able to sell them to what is acceptable, but most importantly, function. And that is it. There are some who've worked on, they're into adulthood, they're so proud of themselves, they are happy with their skin, they understand. That is when we're doing the rehabilitation, we make them.
Yes, I was going to ask you about that. What about the aftercare? I mean, one of the things that Children's Burn Foundation does that really is as important as the surgery is the aftercare, the psychological aspect of a child adapting to their new life. Is there any of that where you're practicing?
Well, one of the things we try to do when we get these children is to make them feel that we are their parents. Like I always say to people, every child is a child of an adult, of every adult. So you don't see a child and treat the child as if it's not the same blood with you. A child is everybody's own. So we, from the day they come in, they see us as their parents. If you go into my burns unit now, if I walk into the children burns unit now, all you hear is, Papa is around, Papa is around. So you just see them shouting, Papa, Papa.
That's a reason to go to work every day.
So they see me as a father. So when my team also come in, oh, auntie, mommy, it's like a family.
Oh my goodness! Yeah, that means they trust you too, which is amazing. So, talk about your working circumstances. You're not the only one that has this practice in the hospital. How many doctors do you have working with you?
Presently, I have about 3 burn trained doctors. Then also we have some residents, about 3 residents. Then we have the nurses. We have about 11 nurses. We have the physiotherapists. We have up to about 5, 6 working with us.
How many patients do you have in the hospital right now?
In the hospital, as we speak now, I have, if you're talking about children, so
right.
Children, I have about 4 children in the hospital being treated for acute burn. So
right.
2 of them have been sponsored by Children's Burns Foundation.
That's wonderful. We sponsor, I think, 6 to 8 patients a year with you, right?
Sometimes it could be more than that.
Yeah, and it's just amazing the work you do. And so, if a child comes in, how do you communicate to us, us meaning CBF, that this is a patient that you need help with?
Yeah, the first thing is for me to establish this child need help. Mm-hmm. A lot of time, maybe somebody informed me that there's a child and the parents are indigent, and they want to go to the traditional doctors who apply the cow dungs to treat them, and that will definitely kill them. And sometimes they come with the sepsis. Before we're able to get out of it, some of them we lose them, some of them we're able to retrieve them. So first of all, identify the one who actually need the help. Then I'm in communication with the Children's Burns Foundation. Canada is doing a very wonderful work, and immediately, sometimes at night,
Are there religious aspects to your relationship with the parents? What I mean is, it depends. If people have different spiritual feelings, does that make them not trust what you do? Or, you said in one of the village treatments would be to put cow dung on the burn. Are there other things that you have to navigate there because people have spiritual differences with the medical community or anything like that?
So that is something, and I think the reason why people do that is because they don't have the money.
Yeah.
They can't afford it. Out-of-the-pocket system in Africa can't just work.
There's no insurance system.
No insurance system.
Oh my goodness.
Even with the insurance system, it's minimal. You're treating malaria. That can't work. In Nigeria, the insurance system is only concerned about just basic flu, malaria. In fact, plastic surgery is not included within the
Even if it's an accident.
the documents. Because plastic surgery is not captured within it.
Do you get any help from the Nigerian government?
No.
Wow.
You just have a hospital, and at the end of the day, we do the surgery, we do everything, and we pay the Nigerian government truly.
Wow.
Because everything you have to pay for.
So you're just doing this because you are a person of God. You're a person of God, and you're doing this to help young people. It's not about making a fortune. It's unbelievable to me that you operate under those circumstances.
Yes, we operate under those circumstances because somebody has to do it.
Yes.
We are created for a purpose. We are created to affect other humans.
Mm-hmm.
The world is like a fluid. Just like those days, we connect the telephone with wires, but we never knew that God has wired the world.
Yes.
And so we tap into it. So we human, as we move about, we should know that we have a relationship with everybody. Every human, even the lower animals, even when we jump into the water, we have a relationship with the fish and everything. So we need to take care of them. So what is the use of taking care of yourself, to live by yourself, to have everything by yourself without taking care of your neighbor?
You probably establish a relationship with these children that never goes away because you've given them a life.
Yeah.
You've transformed them, reinstilled their self-esteem, put them out into the world so they can be productive human beings. And I'm sure you have relationships with some of your former patients that will never be less than perfect.
Mr. Coleman, let me clarify something. There are some of the children that I'm sponsoring in school personally.
Oh my!
Because if they go back home and they become not useful to the society, then we have more problems in our hands.
Wow!
So I've been able to meet someone who, sponsored by Children's Foundation, who's a child of Fulani headsmen, those that will kidnap people. That is the thing. They will kidnap people for money and all, and the child was treated, whereas they are doing it even in the environment we find ourselves. But then, taking care of that child, we know there is help. You will have to show love for hate. And by so doing, these children might say, come, in this world, why should I be bad? Why should I go into doing bad when there are people who are doing good? When you show love to a child, they never forget. They don't. They don't forget.
And often that's what they're missing before they come to you. And that's why they call you daddy when you walk through the surgery area. Wow. Unbelievable. I've often said about the Children's Burn Foundation that we probably do more for international relationships than the State Department does, because on one-on-one, the help we're offering, we're helping you, and then you're helping the kids. We're proving that America is not this great consumer-oriented enemy. You know, I think it really helps.
Because America is not the enemy to the world. What I discover in America is they want to help. They want to help. But in Africa too, we still find people who want to help, who actually want to put so much into making sure these children are okay. But they are very few. They don't have an organized, they are not in an organized form like Children's Foundation. Sometimes you see people walking and try to, okay, let me take on this project and let me try to help this person. I have one young girl who is busy teaching women in rural area how to resuscitate babies when they are finding it difficult to breathe. And she goes about sharing ambu bags. If that is the only thing she's doing to keep some babies alive, that's a great one.
That's her part. Yeah.
That's a wonderful one. So I feel by the time we keep preaching these messages, some other adults will find a place for themselves to help the society, not only expecting from the society, You understand? A lot of people feel, oh, the system will do everything for me. So I love the person who dreamt about Children Burns Foundation and has grown it over the years to become what it is today, even helping people in the remotest of area. Because if I take you to those places where these children are coming from, I'm sure you wouldn't want to go into these places. I've picked children from the smallest jungle. I'll tell you about somebody. There was a girl, Joy. She had burns as a child.
Joy.
Mm-hmm. She has a mental sternal contraction. All the head to the neck were contracted together. And because of that, the parents cannot afford to have her in their house. And they banished her out of the house. This girl was going from jungle to jungle in the bush. While she was there, at 15 years, people went there to rape her. And she got pregnant. Until somebody brought, I think it was when she had complication with the pregnancy and when she was about to deliver, she delivered the baby, but she had some complication that somebody who was treating, who saw her and was trying to help her, and said, how can somebody come to this? And she was able to reach somebody who knew me and asked them to bring the girl. Oh, but with the help of Children Burns Foundation, we were able to relieve the neck and with the good post-operative rehabilitation, we were able to bring her back into the society, even met with the father. Why would you abandon this girl? You can see what she has gone through and all.
And that's fascinating to me. And I mean, that's a cultural thing. You see that in some Middle Eastern countries where if a child has some sort of a physical infirmity, he's rejected from the family. It's like an impurity delivered on them by God or something like that. So do you think the parents reject their children because of their imperfection or because they can't afford to pay for the treatment?
I would say the children are treated in a place that is not the hospital, that is the traditionalist, because the parents does not have the money. That's established. Now, when the deformity arises from it, these parents don't want these children in their space, in the environment. Wow. Because it becomes an eyesore to the people around, and so they banish them. And that's where we find some of them. Like the one we're celebrating now, that you saw the picture, Chinasa.
Oh my goodness. Yeah. I've never seen anything like that.
Yeah. She was abandoned. You could see infection and all. And by the time she approached some people after gathering some money, they said, the best we can do for you is amputate this hand. Until she found Children Burns Foundation and they located me that, what can we do to this hand? I said, no, this hand we won't amputate.
And it wasn't just outer stuff, it was like orthopedic stuff too, to reshape her hand.
Yes, reshape. We have to introduce orthopedics techniques. Oh, we have to introduce plastic surgery techniques to make sure those hands are useful. Chinasa is now out. She's one of my star patients, and she came out with an average of 80% in most of the subjects. And with the same hand, she wrote the exam with the same hand that was about to be amputated.
Yeah, it's so misshapen, it doesn't look like a hand in the before picture.
Yeah, it was a wonderful piece of work by the team to make sure that her hand was not.
I found this interesting irony in the kids that I've met that have benefited from the work of the Children's Burn Foundation. Their confidence has been restored, their self-esteem has been restored, and we talk to them in situations like this on camera. They're so comfortable in their own skin, forgive the expression, that I think because they've survived what they have, it almost makes them adult beyond their years. Some of these kids are so smart and poised. It's unbelievable.
I said the same thing. That's why is it that these kids are so smart? I ask myself, the smart kids getting involved with burns.
It's divine intervention. You know, life challenged them in this way, so we're going to give you a gift in another way.
Yes. Then the other thing is this. How come with Children Burns Foundation, we are able to follow them up. They are still friends to
Yes.
the foundation, even many years after they've been treated.
No, truthfully.
I don't know how Children Burns Foundation are able to identify their resources.
Yes.
And those human resources are, I think, they're one of the best.
Absolutely.
They
The
don't
aftercare, the psychologists, the people that nurse them through that after time
Yeah.
is unbelievable.
Yeah.
And I think that's what you're talking about. They have these, for instance, the teen group
Approach.
functions, and those kids have been through a similar circumstance. And it's like somebody going through the military together. They've had this common experience, and it will never go away.
Yeah.
It's really inspiring to talk to some of these
like
kids.
you come to my unit to see the nurses, Matron Sule, Matron Bakari, and all of them. Just like you will see some of them, even the little kid, they will back them
Yeah.
in the ward.
Yes.
African children like being backed.
Well, yeah.
So when you're crying and your parents are not there, they back the children. You will know, oh, these are nurses backing the children and walking all around. You understand? So it's easy for them to say, okay, let me change your dressing.
Oh.
Let me do this for you. So it
Wonderful.
makes it easy if every one of us just look at these people, those children, as our kids. And it's easier. Some of them walk to the Burns unit and show us their result. Ah, Papa,
Yeah.
I scored 80% in my, and that is it.
Wow.
It.
Well, I knew it was going to be inspiring talking to you. I mean, it's astonishing the miraculous work you do. And during this little video presentation, we're going to show some of the pictures that you showed us before, just to show people the transitions that you are able to make. And you're doing miraculous work, and we're so thankful to have this relationship with you.
Yeah.
Thank you, Doctor.
Thank you so much. Thank you so much. Thank you for having me. And God bless CBF.